a video to accompany the PowerPoint presentation provided to you in this lesson. This particular PowerPoint is something I developed last semester because I thought that there was some value in providing you with a way of looking at the first 4 chapters of the textbook, because there's some very important information in the actual written component of the textbook chapters, and then the exercises and how you go through the coding process. Because as you begin learning and using this new language that we've been using since 2015, it's important that you understand it's a process, and you will get better at it over time. And the only way I know that really works for you to do that is by doing the coding exercise. Just as a reminder, by now you should have you should have your 2 main textbook materials, your course materials. One of those is a textbook, which is called ICD-10 PCS, an Applied Approach. The textbook has narrative information, exercises, and it also has case studies, which are really operative reports. You need the textbook, and you also need the coding manual. And hopefully, if you have issues with any of these materials, you've contacted me by now. But you do need both of these elements at this point in the course to move forward and be able to function in this class. Additionally, at some point later this semester, you will need your AHIMA subscription to the VLab, which will be noted to you in a course announcement, and also will be posted in a particular lesson that you should be getting it and making sure you have secured it. Some of you may have your subscription from last semester, and if you do have a subscription, it should last for 12 months, so you don't need to buy a new subscription if you have one you just purchased the immediately last semester. This is a picture of the current textbook. Again, you should have this and available to use it. And again, this particular presentation is focused on the information in chapters 1 through 4 of this textbook. Also, as noted in the course materials, you can have any vendor of an ICD-10 PCS, what I call a coding manual. This one here on the left is the AHIMA version, and they call it a code book. It's the same exact thing. These are exactly the same piece of hard copy coding manuals. They're just published by 2 different vendors. This one has different colorations. The pages have colors on the side. This one has limited color. And that's the only difference between these 2 publications. At the heart of ICD-10 PCS is the concept of root operations. And right at this moment, and for a large component of this course, we will be focused on coding documentation that relates to the medical and surgical section of ICD-10 PCS. And typically those are the procedures that are done in the operating room by a surgeon. You have to understand that concept of root operations in order to code in ICD-10 PCS. Root operations in ICD-10 PCS relate to the intention and objective of the procedure. In addition, you have to apply the coding guidelines. The coding guidelines are provided to you in the textbook, but they are also provided to you in your coding manual or your coding book. So when you're taking a graded event like a quiz or the midterm or the final, you have access to the coding guidelines in your coding manual. You do not need to memorize them. When you're working on assignments in this class, you have the ability to use any resources you would like, including your textbook. The coding process is discussed for you in chapter 1. I've mentioned it several times throughout this presentation. I've also mentioned it in other audio presentations. It's really a step-by-step way of how you tackle a coding job and how you go through the coding role in terms of looking at the clinical documentation. The first step is to read and review the medical record documentation. In our case, for the most part, once you get into the move out of the beginning of the learning phase, you're coding from a operative report. For the exercises in this class, you're coding one sentences or maybe two sentences. But if you were working as a coder, you would be coding for ICD-10 PCS, you would be coding from an operative report. It is typically a document that is going to be at least one full page, if not more than one page. The next step after you review the documentation is you want to match up the root operations that ICD-10 PCS provides with what was the intention of that particular procedure. And there may be more than one intention. That is how you go about this coding process. Then you move to the index. Now in ICD-10 PCS, using the alpha index is not required, just like in CPT. If you've had CPT, the alpha index is not required in CPT either, but at this stage in your learning, you need to use the alpha index. The best way to use the alpha index is to index by the main term that relates to the root operation. Once you do that, you're given typically 4 characters, the root operation table, and when you index by the root operation, then the subterm is your anatomy of the particular procedure you're coding. So typically when you're at the alpha index, you get 4 character values. You take the first 3 of those and you go to that table. And then you proceed to finish your code or build your code from there. And you must have 7 characters to complete your ICD-10 PCS code. All of the alpha characters, when you're writing your codes or you're typing your codes in this class or in a coding job, if you're writing your codes or typing your codes, all of the alpha characters are uppercase and there's no capital O in ICD-10 PCS. And finally, when you finish your coding, you need to review, check your guidelines, make sure that your documentation matches what the code that you have assigned. In Chapter 1, you have the full definitions of all of the 31 root operations of the medical surgical section. These are also typically found in the front of your coding manual. After the first table in Chapter 1, the publisher of the textbook then broke out those 31 root operations into various groups that they provide to you in separate tables. So it's repetitive information. You should familiarize yourself with these root operation definitions, but you don't need to memorize them word for word. Because as you're coding, you would have the ability to use the root operation definitions because they're in your coding manual. Chapter 2 of your textbook begins talking about the guidelines. Sometimes it's hard for students to really fully grasp these guidelines because you haven't really coded with them yet. So it's important that you go back to Chapter 2 and Chapter 1 throughout the semester, because typically some of the guidelines become much more clear to you when you actually see them used based on your particular piece of documentation that you're coding. At the end of Chapter 2, there are some exercises that I wanted to highlight in this presentation. So one of the reasons I'm highlighting this particular exercise is because it's a common way that a multiple choice question is written, especially on the national exams. It includes a stem, which is that sentence at the beginning. Which of the following is false regarding methods used to build the ICD-10 PCS codes? It's asking you to identify the false element, and sometimes students conceptually don't understand that. So you're looking for the statement of the 4. In this case, there's 4 statements given to you, A, B, C, and D. You're looking for which one of those is not true. So the statements in your textbook are given: A is the index must always be consulted. B is all 7 characters must have values associated with them. C, the code tables must always be referenced. D, values can have different meanings in a given body part. So which one of those statements is false? When we look at the guidelines and the rules and how ICD-10 PCS was structured and created, the only one of those 4 statements that is false is A. Again, A reads, the index must always be consulted, and that is a false statement. We're talking about the alpha index. And again, in ICD-10 PCS and CPT, it is recommended that students and people new to coding use the alpha index. However, it is not required like it is in ICD-10 CM. In ICD-10 CM, you have to use the alpha index. It's part of how that system, that coding classification system, was built. This is not true when we talk about ICD-10 PCS, and that is noted also in guideline A7, which is found in chapter 2, and also would be in the front of your ICD-10 PCS coding manual. The next question I wanted to highlight was number 3. Number 3 reads, the patient has a biopsy of the colon followed by a hemicolectomy. Which procedures are coded? A, the hemicolectomy only. B, the biopsy only. C, both the biopsy and the hemicolectomy. D, it depends on the results of the biopsy. And then your textbook asks you to list the guideline that relates to your choice. The correct answer is C. In ICD-10 PCS, we would code both the biopsy of the colon and the removal of this part of the patient's colon. And that relates back to guideline B3.4b, which states if a diagnostic excision, extraction, or drainage procedure, such as a biopsy, is followed by a more definitive procedure, such as a destruction, excision, or resection, at the same procedure site, both the biopsy and the more definitive treatment are coded. The last exercise I wanted to speak about for chapter 2 is number 5. In number 5, they give you 4 codes from the 0CQ table. They're asking you to identify which of those 4 codes is invalid. The best way to figure that out is to go to the 0CQ table in your ICD-10 PCS coding manual. And when you do that, you know you have to stay in the same row. So once you start OCQ3, for example, you have to stay in the same row going over. So when we look at those 4 codes and we go through that process by using our coding manual, we find that the code OCQ9XZZ is an invalid code. The X character after the 9 in that particular code is not in the same row as the body part character, which is 9. On the slide it says P, but it should say 9. So the X, the 5th character X, is not in the same row as the body part character, which is 9. So you cannot go from one row to another. You have to stay in that row that goes straight across. When you get your body part, typically from the alpha index, because you index by the subterm of the anatomy, you have to stay in that row going across. The next component I wanted to speak about was the distinction between excision and resection in ICD-10 PCS. When we look at the definition of excision, it's noted that the words without replacement and a portion of a body part are included. Conversely, when we look at the definition of resection, it also says without replacement, but it states all of a body part. So the key is how much of the patient's body part is being removed. The other key is, does ICD-10 PCS consider the part of the body that the surgeon is working on a distinct body part? Typically, they're very anatomically correct, but in certain specific body parts, such as the lung, the liver, and the intestines, ICD-10 PCS decided to break those large body parts into individual sections. This relates back to guideline B3.8 that denotes those specific body organs that are divided into distinct body parts within a larger anatomical organ. So for example, if a patient had the removal of the left lower lobe of their lung, per ICD-10 PCS guidelines, we would code that to the root operation of resection, because that particular piece of the lung is considered an individual body part. If only a piece of the lung, left lower lobe area, is removed, then it would be excision. But if the entire left lower lobe of the lung is removed, that would be resection. In your textbook, they also talk about lymph nodes and lymph node chains. They also note the use of the word radical excision of lymph nodes. So if a physician documents a lymph node was biopsied, that would relate to the root operation of excision. But if the physician documents radical resection of lymph nodes, or documents removal, because again, remember, in ICD-10 PCS, the physician doesn't have to use the root operation terminology. So the physician could say removal of an entire lymph node chain, and we would code it to resection. So that's an important distinction when you're reading the documentation, and this is really about your role as a coder to make that linkage between the guidelines and the clinical documentation. The physicians are not required to use resection and excision in the same way as defined by ICD-10 PCS. They also don't have to use the word resection, though they do often use it, but they could say biopsy resection of a lymph node, and you would still, based on the clinical documentation, code that as an excision, even if the physician used the word resection, but it just didn't meet the ICD-10 PCS guideline. Physicians are not required to know coding. Some do, but it's not a requirement, and they are not required to use the definitions as ICD-10 PCS defines them. For excisional biopsies, that is a term that's often used, and you'll see it. Typically, a biopsy is going to be coded to the root operation of excision, and the word biopsy identifies that the physician is taking this specimen from this patient in order to make a diagnostic decision or get some diagnostic information. Therefore, the qualifier character value should be X, because this biopsy tissue is being sent to pathology specifically for analysis and diagnostic information. The one exception is if a patient is having an endometrial biopsy or a bone marrow biopsy. In those particular cases, because of the anatomical location, because of the type of tissue or substance that's being removed, the root operation is extraction, because it's being pulled out of something. Bone marrow is being pulled out of the bone. Endometrial tissue is being pulled out of the uterus. So the root operation then has to relate to how this is being done by the surgeon, and that would be the word extraction. One challenge, however, is that you have to be careful that when you see something was sent to pathology, you don't assume it was for a diagnostic purpose and you don't assume it was a biopsy. You do need that word biopsy, but we don't code everything that was sent to pathology as a biopsy. If a patient had a biopsy in the past and they already know the patient has a diagnosis and they're coming in today to have that mass removed, whether it's benign or cancerous, they already know what type of mass it is. Once they remove it from the patient's body, it's a matter of clinical process for that to be sent to pathology. You're going to confirm again, and we don't remove pieces of patients from them and then just push them aside. They have to be processed and disposed of and recorded in a way for clinical reference in their record, and part of that process is taking that tissue or that sample or that piece of mass in this case to pathology. So don't make the error of just saying sent to pathology, oh, that was a biopsy. You need the word biopsy in order to code it as a biopsy. You don't code everything that was sent to pathology as a biopsy. The next component I wanted to speak about was detachment. This is an interesting definition. Sometimes students struggle with it. Detachment is defined as cutting off all or cutting off part of an upper extremity or cutting off all or part of a lower extremity. Procedure examples that would relate to the root operation of detachment include an above the knee amputation or below the knee amputation or amputation of a finger or also amputation of a toe. Additionally, once you determine that you're going to use detachment, you have to also know where it was cut at on the patient, because there's different types of detachment. There's complete, there's partial, there's low, there's high, and there's mid. Also in ICD-10 PCS, they use the word ray, R-A-Y, and ray means a complete finger or a complete toe. I want to go to the next slide because I want you to see the graphic, because sometimes students get confused about the anatomy. So if a patient had just this one piece of their toe removed, this is not a complete ray. The entire ray is the entire toe, all three phalanges, until we get to the foot. So you have to be careful that you understand the anatomical distinction of the bones and the feet and the bones and the hand. Also, I have pictures here of the hands and also of the knee. So you want to pay attention to that. Also, of course, the documentation. Typically, the physician is not going to use the word high amputation, but he should tell you in the clinical documentation where he began the cut to remove or detach the patient's extremity. Let's go back one slide. So again, we have different kinds of amputation. Complete means amputation through the carpal metacarpal joint of the hand or the tarsal metatarsal joint of the foot, or amputation at the metacarpal phalangeal or metatarsal phalangeal joint for the thumb, finger, or toe. So we're talking about, in this case, these toes. This is a toe. Okay, so you would cut here would be a complete, right here would be a complete toe removal. Additionally, partial amputation is amputation anywhere along the shaft. So if we look back at that picture of the toe, or the toe is actually not a great example to use for the shaft, but anywhere along the shaft or the head of the metacarpal of the hand or the metatarsal of the foot. Now the metatarsal, we can look at that one because we have that in the next slide. Metatarsal, when you look at the flat part of your foot after the toe, that's the metatarsal. The shaft would be here. So this is the head, and here's the shaft. So anywhere in here, if you cut in this area, that would be what they're referring to in the previous slide. So again, when you go to the ICD-10 PCS table, when you're coding detachments, the last qualifier will identify high, mid, low, incomplete, or partial. If the physician uses the word complete, that's all you need to know. You don't need to go looking and see where exactly was it done. If he uses the word complete, you would code it to complete. But if he tells you he cut it at the proximal portion of the shaft of the patient's right humerus, then you would code that to a high amputation of the humerus. It's very helpful that you have some type of graphical pictures. At least I find it helpful. Based on what I've heard, students typically find it helpful. You can access these online. I use Google search very often. I just type in anatomy of leg and I hit images. Or you can purchase something that's called an atlas. An atlas is basically a book. Typically, it's a hard copy book. Typically, you can find them at very reasonable cost at some of the major retailers. Will have those sale areas where they'll be selling books for like $10 or less. And an atlas is basically a book of pictures, anatomy pictures. And it'll have, arrows identifying like these, telling you what these pieces of the anatomy are. It doesn't give you any of the functionality in atlas, but it will give you those pictures if you want something that you can look at right in front of you versus looking at some type of online graphical representation. Midline amputation is amputation at the middle portion of the shaft of the humerus, or the middle portion of the lower arm, or the middle portion of the finger, etc. Also, a mid amputation or detachment is anywhere along the middle phalange of the thumb or the finger or the toe. And then we have the low level, or the low or the distal detachment or amputation. Is a distal portion of the shaft of the humerus, or the distal portion of the femur, or anywhere along the distal phalange of the thumb, finger, or toe. The distal is the furthest from your heart. So we're talking about the furthest part from your trunk or your body, your main trunk of your body would be distal. So ICD-10 PCS really is a coding system, classification system, that requires you to hone in on your anatomy knowledge using that. Also, again, as I stated before, a key component is the root operation, which is tied to the concept or noted as a concept root operation. Definition of a root operation in ICD-10 PCS is the operative intent or objective. The other component that typically students seem to be challenged with at times is identifying the surgical approach based on the clinical documentation. And I talked about that in an earlier lesson when I went through some of the graphical pictures that are provided for you in your textbook back in chapter 1. So when you are coding and you're thinking, is this an open or percutaneous, for example, then you need to flip back to chapter 1, especially if you're doing an assignment. Because those words that are used to define those surgical approaches are important clues for you to look for in your clinical documentation to match up which surgical approach to what you're reading in your clinical documentation. So ICD-10 is a system, a classification system linking together anatomy, operative intention, and surgical approach. So at this point, you have listened for 30 minutes, close to 30 minutes. I'm going to stop this presentation at this point, and this will be part 1, and then I will continue in part 2 that will continue at slide 20 and go over the rest of this particular review, with chapters 1 through 4 of ICD-10 PCS and Applied Approach. Thanks.